Hey, it's Steve Grant here again, and I'm joined by Lara Rickard, dietitian and specialist with polycystic ovarian syndrome. And in this video, we're going to talk about what is PCOS. So take it away.
Sure. So polycystic ovarian syndrome is a complex condition of high androgens that impairs ovulation. But it's really, really important to note that there are other conditions that can cause high androgens, and these need to be ruled out first before coming to a PCOS diagnosis.
Okay, and like what conditions might they be?
So one which presents very similarly to PCOS is the non-classical congenital adrenal hyperplasia.
Okay.
But it has a different cause to PCOS.
Okay, so quite similar symptoms, but important that it could be a completely different diagnosis, and therefore important to work with your doctor just to make sure that you're ruling out certain things.
Yeah.
Because PCOS is a kind of a diagnosis of like a process of elimination in
absolutely,
a sense.
Absolutely.
So tell me more about androgens.
Sure. So our androgens are quotes unquotes male hormones, and the reason for this is that they're higher in men, but women need them too. But and that's for things like our libido, our focus, our muscle mass. But as with anything in the body, if they're too high or out of balance, it causes concern. Okay,
and the androgens that you tend to look for when you're running lab tests, what would you look at?
So I'll look at our testosterone, our androstenedione, and our DHEAS.
Okay, and we spoke about that in a previous video where they can be produced in the ovaries, the adrenal glands, and then fat tissue are actually involved in producing some of those androgens as well. Yeah. So one of the issues obviously with PCOS is the androgens are affecting ovulation.
Yeah.
So do you want to, I think it's probably good to just talk about the female cycle and what ovulation is.
Sure. Yeah, just to understand how ovulation fits into our entire cycle. So if we start with day one, so day one is the first day of our bleed, and at that point our sex hormones should be low. Okay, then as the follicles that could be released for ovulation grow, they release estrogen. As estrogen peaks, it triggers something called luteinizing hormone to spike, and with that spike in luteinizing hormone, we then get ovulation happening. Okay. From there, ovulation happens. The sac that it was in develops the corpus luteum. The corpus luteum is what produces progesterone, and progesterone then rises in the second half of our cycle. If pregnancy doesn't occur, then those sex hormones will fall away and we'll experience a period. So ovulation happens somewhere mid-cycle. It differs for every woman, and it can differ cycle to cycle, and it's the release of that egg.
How might someone know if they've ovulated or not?
Sure. So one of the best ways to track this is using our temperature. Mm-hmm. So we can do, you can get core body temperature trackers or basal body temperature trackers. It's just really important that we get those 2 decimal places on the thermometer, because it's such a slight rise in temperature. And the reason there's that rise in temperature is once ovulation has happened and progesterone starts being produced, progesterone increases our metabolic rates, and that causes that rise in temperature.
Okay.
Important to note though that temperature confirms ovulation, so it'll rise once ovulation has happened.
Okay, that makes sense.
And then other things that we can look at are tracking our cervical mucus. So throughout our cycle that should change, and just before ovulation we'll get almost like an egg white consistency, and then once ovulation has happened as well, it will be that thicker egg white consistency.
Okay.
So we're looking out for that around ovulation. It's important to note, though, a little caveat there, that sometimes if there's imbalance, particularly there's the high estrogen and the lower progesterone, some women will experience that fertile mucus just before their period.
Okay.
As well.
Okay.
So
interesting. So with PCOS then, predominantly an androgenic issue essentially that affects ovulation. So we've just been through the ovulation part of it. So I think what we're going to do in the next videos, we're going to look at symptoms, we're going to look at some of the diagnostic criteria, and we're going to start to go into some of the things that you can do to help with dealing with polycystic ovarian syndrome.